Located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health for every day. Our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, for each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. Matter of fact, it's because of those calls, I think we're going to swing the topic today. You are all interested in ECP out there, or at least I'm getting some wonderful questions from you on the subject. You tend to always introduce it. I like to be able to talk about it today. Let's open them up. If you have any other questions on ECP, we'll be talking about ECP today. Of course, we don't have to limit our discussion to ECP alone. By the way, those letters stand for external counter pulsation. And it is a treatment you'll, if you haven't heard of the term before, learn more about that as the time goes on this morning. But if you don't have ECP on your mind, you want to talk about something else, go right ahead. The number, as always, will be 412-825-6262. That's 412-825-6262. Let's see where it takes us today. Now, looking at the calendar, we've got, what do we got here? We got Mr. Dr. Ed going to be on our show on Monday. It's 1 week away from, at least at that point it will be, 1 week away from his arrival in Pittsburgh. He's going to have that free seminar out there, by the way. Remember, Dr. Edward Condrat, a distinguished ophthalmologist, is coming to town for another treatment seminar. This marks his third within a year. Geez, I remember the day when he did one a year, and now your demand is causing him to come to Pittsburgh 3 times. I know he'll make it 4 if the number suggests it, but he comes to town every so often, and we'll actually have a treatment seminar. This time will be held for 4 days, Monday through Thursday. That's the 22nd of March to the 25th, and it'll be held out at the Marriott, Airport Marriott, which is right at the Montour Run exit going off the Parkway West on the way out to the airport. Choose you cross all that stuff at the top of the hill in Robinson and go down the other side. That first exit is Montour Run. You see that big pink hotel, or it used to be really had a pink hue to it. I don't think it has it that anymore, but that's where it'll be. Of course, free seminar is going to be held on the 21st, which is Sunday, 10 o'clock it starts. I think it's a 3-hour seminar in which Dr. Ed will be available after a presentation that he will put together to entertain questions. You have a lot of questions about whether your eye disorders, either well-established or just beginning, have an amenable solution that's outside of the conventional realm. And although Dr. Edward Condrat is a board-certified ophthalmologist, certainly understands conventional treatment, he well understands what I believe is prompting the majority of people to come to these events, which is the limitations of that conventional treatment. And there are other treatments. We hear about them all the time. We'll hear a little bit about them when we meet with Dr. Ed Condrat on the 15th, and then he'll be talking about those on the 21st. I'll also be on the agenda. I usually give a little 30 to 40-minute address on various topics. I always like meeting you, and I'll see you on the 21st also. So big doings coming up in the month of March. We'll kick it off next Monday with Dr. Edward Condrat. If anybody out there, and I've given this number a couple times already, I'll give it again. If anybody out there thinks they may be interested in attending the treatment seminar, they cut this thing off at 12 participants is all they can handle. And that's the reason why when he was here last in December, he had to quickly schedule a new seminar for March because more than 12 patients were willing to participate. If you want to find out more about that, here is the office number out there in Phoenix. Give them a couple hours until they until they wake up out there. The number is 1-800-430-9328. That's 1-800-430-9328. Also, next week, Christopher Moore is going to be here talking about 4 advances that could end heart disease. I'm very interested in that topic. You can see by how our discussions here, and even today's discussion, swing to cardiovascular disease frequently. And if there are 4 advances that could end heart disease, I'd like to know what they were. Maybe I might have heard of them. Maybe you might have heard of them. But let's see what Christopher Moore brings to us on the 17th. 4 advances that could end heart disease. And there are other offings in the near future. Got a couple of potential guests that we're lining up for the remainder of the month. Can't exactly mention them yet, just because they haven't consented to fully come aboard. We'll let you know as they occur, as we normally do. Now, always talk about 3 product lines we carry here, giving you information on how to get a hold of them. One of them, I'm quite proud to be able to say that we're affiliated with Through the Spirit. Deborah Ray got us interested in this a while back, and she keeps, she does a number of radio spots. You hear them every time we break for a commercial. It's Deborah putting the full force of her reputation behind a product. Good grief, never happened before, at least not that I can remember. And here she is, continuing to support Through the Spirit. We have had Deborah on the show. We had Deanna. We had the formulator, Dr. Peterson, and we will have other guests regarding it. But these great tasting stuff with 14 biblical fruit purees. The 1 ounce equivalent is 5 servings of fruits and vegetables. You just got to you got to try some. I always enjoy the opportunity to give you that free taste. Stop in the office. We'll give you a free taste of the stuff. I think you'll agree with me on the spot. If you are grandparents and have grandchildren that don't take to supplementation too well, you might want to try this. I think you will, and I'll conquer it. So 1 is Through the Spirit. The way to get a hold of it, 1-800-442-3793 will do it, 1-800-442-3793, or you can order online at fruitspirit.net. That's not fruitofthespirit.net, that's fruitspirit.net. Number 2, the Ciara holographic chips. Great responses, especially with pain problems. Found that out really, as I've mentioned to you, at the Gene Hanlow's gathering at the St. Francis Convent, Castle Shannon, on the 1st of March. Anyway, if you're intrigued by it, and if you're coming in all ready to see me, we'll place a chip on you, and we'll see how it works for you. If not, you can order these chips by going to the website at www.drcourtney.ciara.com. The doctor spelled DR without a period at the end of it. drcourtney.ciara.com. And you can order them online. You'll see my name pop up there. Also want to mention diabetics. There's an APB out for you diabetics out there. Footwear. We have just an excellent company that custom makes footwear, shoes. What do I mean by footwear? Shoes. Diabetics have to be very careful about the kind of shoes that they wear, and custom made certainly would be the better choice. Also, all the diabetic supplies are delivered right to you. We can arrange for it. We'll help you get it done. Just either come in to see me or give a call so that we can get you scheduled to come on out here. You can see our little shoe rack here in the waiting room, but come on and see us if you want to know more about it, and we'll be happy to help you. Insurance covered because of your diabetes, absolutely covered. Okay, heard a knock at the door. Come on in the store. Hello and welcome in.
Hey, Dr. Courtney, what's happening?
Hello, is that you, Danville?
Yeah, do I sound different?
You do sound different. You sound like you're in a tunnel.
Okay, well, I'm in my living room, but never mind.
Okay, are you getting us in?
The wrong thing. I wanted to get chondroitin sulfate and glucosamine
Sulfate,
but I thought there was another glucosamine that I read. Is there another glucosamine something?
Well, the two are products for joint discomfort are married together, chondroitin and glucosamine sulfate. If there's another form of of glucosamine as there is in just about every other thing, whether it's a mag citrate, mag gluconate. I mean, there could very well be a product with another substance, but as far as I know, the literature is abounding on the sulfate product. So you could Google it up and read a whole heck of a lot on that combination.
Yeah, I went to that site where we're talking about. Remember, I said I saw non-GMO. I also have seen some stuff in I was at a Whole Foods. I actually went to Nashville over the weekend. Oh boy, what a ride with 6 kids.
Oh boy, yeah, sounds rough.
Yeah, it was great. Let me tell you. Yeah, they drove me nuts, but.
Well, do you refer to Whole Foods as we do here in Pittsburgh? Because we have a Whole Foods, but it's been dubbed Whole Paycheck because it's so expensive there. You agree?
They're a little bit expensive, but they're not that bad. I mean,
all right.
They're a little bit high, but.
All right, just
stuff, but
throw out another. I'm going to throw out another chain, and you can probably Google them up and find out if they're nearby you, called Right by Nature. We find them to be extreme. I think the pricing there is extremely fair. At least we have one here in Pittsburgh called Right by Nature.
Okay.
Okay?
All righty, you have a good one.
You too, Danville. Thanks for checking in, Danville. God bless his soul. Okay. There he is. Danville has checked in, and he has just left the building. Okay. Look, so we're going to open it up today. Why don't we do this? I got a blurb from the mass media. It enrages me. See if it enrages you. Something they're putting in the foods again, and Lord knows we keep bringing to you these blurbs. Going to talk about it when we return. You can call up at any moment, 412-825-6262. I promise we'll get on to the subject of ECP. You always seem to want to talk about it. Maybe it'll prompt some additional questions on this interesting and very helpful procedure. Be back in a moment.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what to eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith, but Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Hey, good morning, everybody, and welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9. I'm Dr. Dennis Courtney, alive and live with you today in this March 10th episode of our show. And today I'm going to open it up for you to set the agenda, 412-825-6262. Promised we'd spend some time talking about ECP. You appear to want to talk about it. You keep calling and asking questions about it, and I really enjoy your enthusiasm and interest. Getting any questions that are starting to well up inside and need to be expressed, 412-825-6262 is the number to do it. We'll get to a discussion of ECP in a bit, as well as anything else on your mind. Doesn't have to be ECP, but this got my attention. It's got my dander up. It'll get your dander up too. This comes from the Mercola site. Mercola is really good. We have a little thing here in Pittsburgh. We say, Joe said it would. Well, it's probably not the appropriate English to say Joe Mercola said it would, but Joe says it is. It is happening, and this is the kind of stuff that you need to know. Listeners to this show need to know to be able to make you the better consumer. This happens to do with, how about this for a byline? The byline is, banned in 160 nations, but it's legal here. Geez, you probably say to yourself, well, that's that along with a whole host of other things, whatever that turns out to be. Responsible for it, whatever this banned substance is we'll be talking about here, responsible for it, number one, hyperactivity, 2, muscle breakdown, number 3, 10% mortality in pigs, nice to know. The name of this stuff, generically, it's a drug that's generically called ractopamine, ractopamine, R-A-C-T-O-P-A-M-I-N-E, ractopamine, better known in the industry as either Paline, interesting, or Optiflex. What is this drug? What's it do? Well, it turns out it increases protein synthesis, which consequently leads to increased muscle mass, and it's given to the animal near slaughter to get a better yield. Isn't that what it's all about? Isn't that what it's all about? So that if they can give this stuff as animals are nearing slaughter, the protein synthesis issue causes increased muscle mass. The animal weighs more and therefore is worth more to the cattleman at the time that the weigh-in occurs for the slaughter. So this is why the boys came up with it to begin with. Listen to this. The drug carries, this ractopamine, Paline, I guess I'll call it, drug carries these warnings. Remember, it's FDA approved here, banned in 160 countries. Not for use in humans. Interesting. But if they give it to the animal, and you eat the animal, are you not getting this substance? Well, it turns out you are. We'll talk about that in a minute. It's not to be used in humans. Number 2, individuals with cardiovascular disease, so the warning label reads, should exercise special precautions to avoid exposure. Number 1, they should wear protective clothing, this according to your FDA and the company. Number 2, impervious gloves where nothing can get through the material to touch your skin. This if you have a cardiovascular disease. Protective eyewear and NIOSH-approved dust masks. This all right off the label of this drug called Paline, approved for use in the United States, banned in 160 countries. All of Europe, Taiwan, and get a load of this, China. I thought China loaded us up with these contamination projects. Even they have a set of standards. They said, you know what, we can tolerate it, but that Paline, we don't want any of that. China banned it. So China banned it. We say, come right on in here, boys, and just bring the cattle in and have them load up on the stuff. Now, how frequent is this used? Well, according to the blurb on Joe's site, used in 45% of pigs, so 45% of the meat, pork in the supermarkets, got the stuff in it. 30% of ration-fed cattle, and an unknown percentage of turkeys, all given to them at or about the time of slaughter. Interesting little thing about it is that all the other drugs, and of course we've talked about many of the other drugs, all the other drugs that are used, the steroids, the growth hormone, the bovine growth hormone, all these other things cannot be given within 2 weeks of slaughter for what is called a washout period. So the claim is, geez, we may have used this stuff a lot, but for the last 2 weeks before slaughter, don't give any more of it, so at least the stuff will wash out, meaning that that the residues of these products give them a chance to leave the carcass of the animal. But in the case of Paline, there is no washout period. This is used, in fact, the closer they can use it to the time of slaughter, the greater the protein synthesis that occurs, the greater the weight of the animal, therefore the greater yield. All this is got a smell to it, does it? Well, how can it be that that we get to use such a product when the rest of the world says and China of all people says, man, you got to be kidding me. We just don't, we can't be using this stuff. This is deadly stuff. Even in China, we don't want it. But it's okay here in America. Well, this little fact, and I'll end it with this. Okay, has to do with, here he is, some guy named Michael Taylor. Now, I'd never heard of Michael Taylor before, but get a load of this little ditty here, and it sort of answers the question. Michael Taylor, a former vice president of public policy and chief lobbyist at Monsanto. I think we heard of that one before. Monsanto, there you go, is now the senior advisor for the U.S. Food and Drug Administration. Oh my goodness gracious, looks as though there could be some chicanery going on. Who is Michael Taylor? Well, he's the person who not only oversaw the creation of the GMO policy, a genetically modified food policy that Monsanto kicked off in the 90s, and it turns out Michael Taylor, I never knew his name before, he was the guy who oversaw the creation of that policy, according to Jeffrey Smith, the leading spokesperson on the dangers of GM foods, but also oversaw the policy regarding Monsanto's genetically engineered bovine growth hormone. Oh, my goodness gracious. The growth hormone, which has been banned in Canada and Canada, Europe, Japan, Australia, New Zealand, and I emphasize once again, China. Look, you need to get lathered up. I don't know what supermarkets you go to. I don't see how you can stay out of these bigger supermarkets. You're in them all the time. You might want to do what I do intend to do, and I'll report back to you on how it went. I'm going to my local, look at big Giant Eagle near me. I'm going to my local Giant Eagle and see what I can stir up. Giant Eagle, at the Giant Eagle, finding out if they know if the meats that they package and sell to the consumer contain this stuff. They're probably going to be looking at me like I'm a crazy person, but I'm going to ask questions. I'm going to find out, hey, they need to get answers. I want to know. 30% of the beef, 45% of pork, and an unknown percentage of turkeys. You know it's winding up on those shelves. And this is bad stuff. Very bad stuff. And we'll let it go at that. Had to mention to you, we thank Joe. Joe, who always comes up with these blurbs. This one caught my eye and really enraged me. How's it doing? How's it doing for you? China said no. U.S., bring it right on in. All right. Let's take a short break. I'll calm down. Put my feet on terra firma. I'm off my high horse. I'm back. Hey, what do you want to talk about? ECP, let's talk a little bit about it. Anything on your mind is okay with me. 412-825-6262. Be back in a minute.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, everybody. Welcome back once again to AM Impact on Your Health. Right here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, alive and live with you today. Enjoying to spend some time with you, allowing you to open up, set the agenda around here. I figured because of all of your interest, we'd talk a little bit about ECP. I do intend to do that when and if we get a lull in the conversation. You may just sort of take it away and talk about it or something else. 412-825-6262. Will allow you to knock on the door and come on in the store. In fact, in the interim, we have someone do that. Knock on there with us right now. Let's say good morning, hello, and welcome aboard. Hi there. Hello?
Hello?
Yes, go right ahead.
Oh, can you hear me?
I can sure hear you.
Oh, hi, Dr. Courtney.
Hi.
I love your program, by the way.
I'm glad you do. Really enjoy bringing it to you. What's on your mind today?
Yeah, I have a question. I went to the doctors, and I have borderline diabetes, blood sugar 135.
Okay.
And she put me on metformin, and I just wanted your comments on the metformin and my blood sugars.
Oh, boy.
Now, they've been in the 120, 110 in the morning when I get up. So
I got one question to ask you. You told me what a fasting sugar was. Did you have done this really important thing called a hemoglobin A1C? Did he do that on you?
Yes.
Okay. Do you remember what the number was?
I know that it was like 6.8.
Okay. All right.
I had come down after that.
That's a pretty high. Hemoglobin A1C is really the true measure. So you are. I don't want to do this in any disrespectful way, but you're not borderline. You're full blown. Okay. Let's get this up on the table. You push your foot around. You're full blown diabetic because that hemoglobin A1C, which is really a measure of your blood sugars over a 90 to 120 day period, really says so much more than an isolated single blood sugar. In fact, what I have found so oftentimes, if that was a fasting blood sugar,
Yeah, it was.
It was. I find that when people, I'm going to say, are borderline, because the fasting blood sugar, I've actually found it to be well in what was called a normal range. And then we did an A1C. We went, my goodness gracious, this A1C clearly indicates that you're not borderline. You're full blown too. But how is it then that you have a normal fasting blood sugar? Well, as it turns out, in a lot of folks, the sleep period, the time when you go to bed at night, is the period where your body can reach a homeostatic level with respect to your glucose to allow for the fasting blood sugar in the morning to come right on dead normal. And so, but when you do the A1C, it'll show that you're off. I say the A1C is the better measure. In your case, both were out of whack, but your A1C tells a better story than your fasting blood sugar. Now, you asked another question. He put you on metformin.
Yes.
And, of course, this is what is used as a treatment for type 2 diabetes, which is the most prevalent and common type, where you have an overabundance of insulin and a resistance of the tissues to insulin, so you can't quite handle sugars well because your insulin regulation is off. Metformin helps to adjust that. Now, to the extent that it's a drug and it can help, I say these things. Number one, have you attempted to correct this with diet alone? Have you attempted?
I have attempted to correct it, and I've lost 12 pounds.
Very good.
And the blood sugars have come down.
Yeah, I mean, your glycemic...
Another A1C next month.
Okay, and probably it may be too soon unless the last one you got was 2 months ago. You shouldn't be getting A1Cs except about every 3 months because it's...
Okay.
Okay, so keep that in mind. Next, with respect to diet, you need to be in the foods with a low glycemic index. There are good carbs and there's bad carbs, and the good carbs are essentially all the vegetables, and the bad carbs are anything white. That could be breads, pastas, you name it, certainly any sugars and things like that. So an earnest attempt at trying to eliminate these bad carbs is well worthwhile. This could be an exercise that has a big payoff. I don't know if you've attempted that or not. Also, too, going to bring in. I got a great friend who's he keeps on. He's not medical, but he had diabetes that required medication, and he utilizes cinnamon and honey every morning.
Oh, okay.
Cinnamon, and he has sworn by this so much. I pass this little thing on. I don't find it written anywhere. I see that he has taken his blood sugars and brought them well within control by having morning tea with cinnamon and honey. You would think, well, geez, how should that help? Well, it does. It tremendously help, and so you should try that also. Okay. The drugs, and I mention him because as full-blown a diabetic as he certainly was, he no longer takes any drugs. In fact, when he occasionally sneaks a half of his metformin in, he drops his blood sugar so much that he gets dizzy. He can't take it anymore.
Oh, my gosh.
So how about bringing in that little aspect and cleaning up the glycemic index of your foods, which essentially is a dietary component. Bring on in this cinnamon-honey combination in the mornings, which is the only time he does it, and let's see how that works with your next hemoglobin A1C and fastings, okay?
Oh, yes, great.
Absolutely. Give it a try.
Yes, sir. Thank you very much.
You're welcome. Okay.
Okay.
By the way, all diabetics out there, and for this particular patient, that cinnamon honey thing is really fascinating how well that has helped. Not just the friend that I talked to, but he's got his own little medical market corner where he talks to other diabetics, and they've got similar results. So it's not just happening with him. But it has had a remarkable effect. Hey, what's on your mind today? 412-825-6262 is a number to get in here and take a hold of this show and determine what our conversation is going to swing toward. In the meantime, I'll wait and maybe talk a little bit about what I find is continually coming up as we do shows and allow you to call in. You had a lot of questions on ECP. It has become something that we prided ourselves on in the last 7 years or so because we've offered it for that long a period of time. We have two devices here. This ECP stands for external counterpulsation, is just a miraculous tool that helps to establish a brand spanking new blood flow to the heart as well as all the other organs of the body. And it's not really presented that way too frequently, but after 7 years of seeing case after case where, okay, if you have angina, have chest pain, if you have it so bad you actually take nitroglycerin, and there very well may be a number of listeners out there who do just that. And you take it when you're physically active, and you get that bit of chest pain, which indicates that you have such an accumulation of plaque that you are robbing the blood supply from your coronary arteries, or artery could be one of many. How do you deal with that? Well, one of the things that you can do is getting yourself involved in an ECP program, where this device, which essentially is sets of pretty large blood pressure cuffs that go around the calves, the thighs, and the hips, and are set to constrict, triggering off your heart complex. So you're going to put the 3 little leads on your chest, and the machine is able to determine where you are in your heart cycle during the contraction of the heart. Well, the cuffs are deflated, and so there's not the heart trying to squeeze blood out when a large volume, of course, and that's what's happening. All the blood from the lower extremities are being forced above the waist at each beat, but they only do that. The blood flow only increases secondary to the squeezing of the extremities during the relaxation of the heart. And the valves are closed at that particular point. And so there is no counter pressures here in terms of the heart trying to pump something out and meeting a pretty large resistance of the volume of blood coming from the lower extremities. It's quite the opposite. It's happening during the relaxation phase of the heart, when the filling of the heart occurs anyway. And one other thing happens right at the beginning of the relaxation of the heart. And what that is that is the prime time, that is the only time, actually, that the coronary arteries actually fill with blood. So the filling of the coronary arteries occurs right at the beginning of what's called diastole, or relaxation of the heart. And that's when the device is triggered to cause the squeezing effect, literally forcing blood from the lower extremities and the hips, which is a pretty good volume of blood, up into the central circulation. Happens at each beat. So if you got a heart rate of 60 times a minute, 70 times a minute, that kind of cycling would occur 60 times or 70 times a minute, and you're on this device for about an hour. Questions have come up. Geez, how is that? Is that tolerable? And I think you heard me mention last time that it sounds like it might not be. I know that. I know when I first got on that device and the thing started squeezing, I went, you know what? I don't think I can do this for an hour. But what happens is it just stays at a steady rate and pace and compression around the extremities, so much so that you just get used to it and you forget about it. And it doesn't bother you at all. And as I mentioned the other day when I had some questions come in while I was doing the show on ECP, the majority of patients that I see, when I peek my head in the door and take a look at the folks on the device for that particular hour, they end up just sleeping on their own. They get so used to that constant rhythmic, sort of mundane, over and over again, not painful at all experience that occurs with each beat, that they just get so used to it, they end up snoring and sleeping on their own. They, of course, can watch television, have a television in there, for those of you that want to have their mind directed towards something else other than this cyclic squeezing of the extremities. Anyway, why do you do this? So what is it that really is the benefit of ECP? Now here it comes. It is scientifically proven that this happens, and by virtue of it, I have seen the tremendous turnarounds that we speak of, talking about people who have chest pain, who are on nitroglycerin, and then all but 10 treatments in and so forth, their chest pain is diminished, and then by the time it's over, we see it over and over again, their chest pain's gone. They don't need the nitrates anymore. What an interesting thing to happen, especially when there's really nothing in the conventional realm short of heroic, very, very invasive procedures such as angiography, balloon angioplasty, stent placement, and coronary artery bypass grafting. Those heroic measures which carry quite a bit of risk and potential side effects to them don't need to be utilized anymore. I really think that the numbers of legitimately asking someone to consent to something like those things has gone down considerably in the population of people who do ECP, a completely non-invasive, no side effects, no problems whatsoever, based on, and now the mechanism. How is it that it works? Well, the volume of blood that moves up into the heart as well as all the other organs of the body is admittedly a tremendously large volume of blood. It's not harmful to you to have that amount of blood assault the organs above the waist, whether that may be the brain, the kidneys, the lungs, the liver, the gallbladder, the heart, you name it. Every organ is receiving an amount of blood that they normally don't see, and they never will see. And there's an attempt on the part of blood vessels to try best as they can, even though they're never really going to be able to completely accomplish this goal. They try to accommodate that increased volume of blood. And so they have a hormonal mechanism to try, at least to try to accommodate these large volumes of blood that are being directed to it at each heartbeat. And they secrete a hormone. The hormone has a name. The name is called VEGF. VEGF. VEGF is an acronym for vascular endothelial growth factor. And so under the influence of that hormone, what happens is you grow a brand spanking new set of blood vessels around, yes, the heart, but around all other organs too. And so I believe a question that came up the other day was, well, does this work in someone who may have had a stroke? And absolutely it does. In fact, in someone who has Alzheimer's, because I think that was really where the question came from the other day, would ECP be beneficial? And I will tell you, it absolutely will, because I've seen it happen. And there, whereas no other even alternative treatment really works. The conventional treatments, there are none for Alzheimer's. And I've got to say that the conventional treatments, or the alternative treatments for Alzheimer's, have not met with great success either. And that's because the amyloid plaque found in the brain in Alzheimer's, there is no Drano-4. There is no way you can diminish the amount of plaque that causes the blood vasculature to diminish the inflow to areas of the brain. So what you do with ECP is by making brand new blood vessels, by virtue of that hormone, you're able to bring a fresh blood supply, albeit in a set of blood vessels that haven't loaded up with plaque, and consequently the response is startling when I see it. So that's the mechanism. ECP, by the way, is interestingly a device that is invented by and researched by and approved by virtue of this right out of conventional medicine. It is a device that the cardiology community has put its stamp of approval on, so much so that only a cardiologist is allowed to refer a patient onto ECP, and it's really one of the big reasons why we have our Dr. Caminos, board-certified cardiologist, who literally comes to my office twice a month so as to be able to evaluate patients, yes, from their entire cardiovascular perspective, but with always in mind as to whether or not ECP would be indicated. And so we'll get that cardiology approval to allow to legally move you to doing ECP and have an insurance covered. This is an insurance covered modality that is completely FDA approved, and conventional medicine invented it. They just don't use it. That's the story on ECP. I hope it helped you. If you want to ask more about it, go right ahead. You can give us a call, 412-825-6262. Let's take a short break, and when we return, see if anybody has knocked on the door and let them on in the store. Anything on your mind is okay with me. It could be on ECP. It could be on anything. It's okay. Be back in a moment.
This is Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some
Oh, yeah.
The one call waiting. I won't keep you for that one call.
Thank you, Barry.
that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Hey, good morning, everybody. Welcome back once again to AIM Impact on Your Health. I'm Dr. Dennis Courtney with you today on this March 10th day, allowing you to set the agenda today. Anything on your mind is okay with me. 412-825-6262 is the number to get in on this. And I do believe we have a caller in the interim that is knocking on the door. Let's let him come right ahead. Good morning, hello, and welcome.
Hi, Dr. Courtney. It's Jerry.
Hi.
A couple questions for you. I recently referred a couple people to you in regards to cancer treatment.
Okay.
And I wanted to talk about that. But before doing that, I wanted to get back to the ECP. And I called into the show back a couple of shows ago when you were talking about ECP and was asking about, is there supplementation that you could do while you're getting ECP to help augment or encourage the formation of the growth factor?
The supplementation, the direct answer to that question is, don't know of any supplements that cause the increased output of VEGF, which is, I think, the direct answer to your question, okay? Nonetheless, because it's a physiological process, any deficiency or toxicity state, here we go, Ray Freeman Francis, okay? Any deficiency or toxicity state can be impacted upon by the correct supplementation regime. So any body process can be brought along by those two components. It's just, I don't know of a specific supplement that you can say increases the output of VEGF.
Yeah, I'm just wondering though if there's biochemical limiting factor. I'm assuming that your body has limitations as to how much you would normally make under normal circumstances, and while you're getting those treatments, that being an abnormal circumstance and really pushing your body to produce a lot more of the compound than normal, you know, what would be the limiting factor and your body being able to make that?
Hey, I'll go one step further. I don't believe that in the construct of our normal daily activity that any VEGF gets made, because the blood vessels never get challenged with that volume of blood. Even if you're like a Kip Keino long-distance runner, okay, there are limitations to what the physiological ability for your heart is to be able to move blood around the system. That can only be if Kip were. I use Kip Keino. He's like, do you know Kip Keino? You remember Kip Keino, by the way? He's a Ethiopian runner who won the Olympics.
Right.
Okay. Anyway, he's like a machine. Now Kip would have a wonderful time in the day if he knew about ECP. If with all he had going for him cardiovascularly, would also have done ECP, he would have been a double machine. I contend. But just in the course of normal physical activity, I don't believe VEGF gets put out to any great extent.
Okay, let me switch to cancer real quickly.
Sure.
Give other callers. Bone cancer. Is this something you think that it's two factors or two parts to it? Vitamin C, IV administration of vitamin C,
absolutely,
and or using the BRM4 to boost immunity. Can you comment on those? Hang up and listen.
Very good. Both questions very good. With respect to high-dose vitamin C, I brought this up to Raymond Francis when we were talking. Raymond Kip wanted to go back to his formulation of you got to correct deficiencies and you got to detoxify, get rid of toxicities, and it is his formula for everything and any disease, because he says that disease is only one disease when cells aren't working right. Yet he was quick to jump on the fact that high-dose vitamin C is absolutely a must because it's cytotoxic. And I keep telling patients, who come to me with well-intended therapies in mind, that the people who propose them were well-intended, but I ask them, where's the beef? Where's the cytotoxic component? Where is it that what you're doing actually has the potential to kill these tumors and do so without harming normal tissue? The answer usually is there is no component of cytotoxicity, and I believe it's a therapy that is woefully lacking if there is no cytotoxic component, especially one that doesn't harm good cells. And the only way I know to do that is with high-dose vitamin C. BRM4 stimulates the production of natural killer cells and is an absolute adjunct, an immune system adjunct, and we'll let it go at that. Another knock on the door. Come on in the store. Hello and welcome aboard. Come right on in.
Hi, Dr. Courtney.
Hey, go right ahead.
Teresa here.
Yeah, Teresa.
For telling more about ECP.
Oh, you people demand it. You keep talking about it yourself, so I mentioned a little more today. Did it help? Did it help?
Oh, yeah, it's really good because I was telling somebody else about it, too. And then she can have more information. And I wanted to ask you something like the procedure then to determine, like, if I really should consider taking it for myself would be to call your office and maybe make an appointment with your cardiologist.
For you, well, for you and everybody else, the way you want to do this is you want to call in and make an appointment to see me.
Oh, okay.
And then when in their discussion, we're going to be talking about ECP as well as pretty much all of what a protocol should be. ECP is just a piece of the protocol. That there is an entire protocol that is multi-pronged that we need to explain. And then in the course of that explanation, once that's complete, we walk out to the desk and we say, okay, to Kim, this patient now needs to see Dr. Caminos, and then they arrange to do that. So get to see me first, then you see Dr. Caminos, and then all the great things happen because you're being evaluated and managed by a cardiologist, which I like, and also get the input of another look from another perspective, which I also like, and allow the patient to decide what they want to do. Do they want to pursue conventional or non-conventional?
Well, I'm not into conventional, but I am into getting IV nutrition elsewhere.
Uh-huh.
I don't know if you give it, but I didn't know if you give it.
We give it. You'll be just look. Come on in and see me so we can talk about that too. Which is
your number is?
Okay, it's 724-942-3002.
Okay, and let me just say quickly, in the past, many years ago, I got better from cancer under the supervision of a Reams tester, and the main teaching there was cleanse and nourish the body.
There you go. Raymond Francis's
but I'm saying
formula.
That I want to credit the Reams testers, Dr. Carrie Reams' teachings and his testers. I want to credit. I know Raymond Francis is saying that too in his book and everything, but
he didn't seem to know about Reams testing. Yeah, he didn't think but he may not be familiar with it. You certainly have the right to speak of the positive effect it had on you, and I'm glad you mentioned it.
Reams testing, I want to speak for it. It's so simplicity.
Okay.
Okay, thank you. I'll call your office.
I'll be looking forward to seeing you.
Okay, bye-bye.
Okay. Quickly, next on the door. Come on the store. Hello, and welcome in.
Good morning, Dr. Courtney.
Go ahead.
Real quick, I was listening to your program. You might be able to augment, or have you read anything about maybe taking nitroglycerin with the ECP, because NO groups would cause some vasodilation and might augment the procedure.
I think if you think about it a little further, and I know we're getting bongoed here, taking nitro at the time will dilate the blood vessels and diminish the flow, okay? In other words, the pressure in the system would lower, and so I'm personally not looking at nitroglycerin as being something I'd want to take. I understand about the NO groups, okay? I understand that.
Yeah, because you might be able to use arginine or some amino acids that would donate NO groups too.
But it wouldn't be helpful during the procedure. We want something.
You want more resistance.
We want more resistance.
Okay.
Okay, great call as usual, folks. Bongos in the background. Look, I'll see you on Friday. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, Director of the Courtney Medical Group, located at 3075 Washington Post, McMurray, Pennsylvania.